So I'd like to just really quickly introduce our presenter, Dr. Jenifer McGuire, who is a professor of family social science and extension specialist at the University of Minnesota. She earned a PhD in human development and family studies in 2003, a master's in public health in 2001, and a master's in family studies in 1998, all from the University of Arizona in beautiful Tucson. Research focused are on health and well-being of transgender youth, and really interest in how social contexts like schools and families influence the well-being of trans and gender non-conforming young people, and has really spent a lot of time in the last several years working on measurement development for gender identity and family gender environment in particular, which has been really groundbreaking and informative, both from a practice and research standpoint. Feel free to check out her full bio on her profile page at the University of Minnesota website. But without further ado, let me turn it over to Dr. McGuire. Thanks for being with us.
Thank you, Dr. Fish, for that introduction. And hi, everyone. Welcome to this talk. I'm happy to see you. So I'll start first by saying, if you have questions as we go, I'm happy to answer them during, and Dr. Fish will moderate the question and answer system. So please submit your questions, and Dr. Fish, if there's questions that come up that are relevant in the moment, go ahead and me or interrupt and let me know, and I can answer them as we move forward, because I think it's sometimes easier to attend to questions if they're content relevant during the time. So please don't hesitate to ask while we're moving along. So today I'm going to talk a little bit about family gender environment as a developmental context and how it's linked to well-being among gender and sexual minority young people. I want to start by acknowledging a number of the many people who've been involved in this research. As Dr. Fish said, we're working on this. I wouldn't say 15 years, but maybe like 8-9 years. And over time, I've been approaching this in a lot of different ways and with different age groups. And so some of the people who've been close collaborators have been, well, for starters, some of you, I'm sure, know Sam Allen, who just finished his dissertation on this topic about a year ago, and did some work with this scale in particular. Catherine Schaefer and Sloan Oakbury Anderson and Quinn Morrow are PhD students working with me here at the University of Minnesota. They've all been instrumental in work on this measure, and as well as with this concept. Jessica Fish, of course, has been working on this and has done some of the analyses with me in terms of how to think about these scales. And then Diane Berg is a collaborator here who works in the clinic here in Minnesota and has worked with me on this too, and using these measures in a clinical context. So first, I think we all understand the concept of family as an important social institution and socializer. Our families teach us and reinforce our social norms. They reflect and or disaffirm our self-concept. So something big that's changed in the last 20 years in the way that we think about family and gender identity is there's been a broad acceptance that families don't influence what our actual gender identity is. So this is something that's always been well understood in the queer community, that your family does not affect your actual gender identity. But what your family does influence is how you feel about your gender identity and how you feel about yourself in your gender identity or in your sexual orientation. And so this nuance and this understanding of how families do influence gender and one's thinking about one's gender has become more the area of study, rather than does your family make you gay or does your family make you trans? So those initial questions of, do children of gay people become gay, or do children of trans people become trans, or does having gay parents make you trans? Those kinds of questions have fallen out of relevance in terms of what we might ask as a research question. And we've now come into how does the environment in a family influence the upbringing of a child, and does having a parent who is more or less open-minded about gender and gender roles influence the way a child experiences their own gender? And then does that matter if a child is or isn't more or less gender nonconforming? So if a child is relatively gender conforming, And then does it matter if their parent is more or less gender conforming or open-minded about that, as opposed to a child who's less gender conforming having a parent who is more gender conforming? So what's the mismatch on that and the match on that, and how does that matter? I think the concentric circles over here to the left are not going to be a big surprise to anyone. They're a vague representation of a Bronfenbrenner or ecological model, and we all understand that the individual kind of exists within this family context, and that family is around the individual. They don't create the individual, but they're kind of the water that we swim in. Within families, there are a variety of things that we do develop within our families, and that shape the way that our families might interact with each other. And there are things that our families do or don't do that may then influence how we feel about ourselves. So there's a few specific things to cover. So one is our gender identity. That's the label that we use. That's the name that we take for who we are. Our families may or may not acknowledge our gender identity. They might label us with a certain gender identity that we do or don't accept. So for the most part, most families give a child a gender identity when they're born. So this is a boy, this is a girl, or I'm not going to give this child an identity. I'm going to let this child develop their own identity. With that identity comes all kinds of roles and role expectations. And so again, most families have a set of roles that they assign to identities. So I have decided, this child is a boy. This child's been labeled as a boy. And with this label of boy comes all kinds of roles that as a parent, I will assign to this child. Some parents have more roles that they assign than others. And some parents work really hard to not over assign roles. And some parents have very strong feelings that it's important to have clear roles. There's a lot of variability in how families do this. Gender expression has more to do with the way that the individual person chooses to show their gender. So people express their gender in thousands, millions of ways. Sometimes it's highly regulated by society, and sometimes people are given a lot of freedom about how they express it. Clothing is one of the most easy ways to talk about how we express our gender. Sometimes it's subtle, sometimes it's very overt. Hairstyles is another, makeup is another, fingernails, behaviors and attitudes, also language are another. Gender schema is something that you might hear a lot about if you take developmental science courses or if you're in cognitive psychology. I'll think a couple of my PhD students who've really been pushing my thinking around gender schema lately. Gender schema are the ways that gender ideas are organized in your head cognitively, and then that affects what you expect. So you might have a gender schema about what something is and how people should act based on who they are. So one of the things we've been coming to realize in our work is that there's a developing gender schema around non-binary identities. So there is a gender schema around what is expected when somebody is non-binary. And when someone violates that schema, people tend to get bothered by it. So if you expect someone who is a certain gender or gender identity to act a certain way, and then they violate that schema, people tend to get angry. And so that's where you see, this violation of gender schema is often described as the underlying cause of why people who are gender nonconforming are often at risk for more violence and bullying, is that the violation of gender schema is something that other people tend to respond to with anger. Gender schema is something that is often created and reinforced in families. So the association of one idea with another, and that this is how a certain gender should behave, can be created and reinforced in families. That can be created and reinforced through policing of gender. So Policing of gender is something that happens like, don't wear that lipstick, it's too bright, or you can't mow the lawn because you're a girl, or you have to mow the lawn because you're a boy, or stop crying because you're a boy, that kind of thing. Or just even a sideways glance at when someone's crying, who's a boy. Those are all the kinds of things that families do. So all families do these things, and they all do them differently, and all children are subject to these kinds of environments, whether they're gender nonconforming or not. So we all grow up in a gender environment, and the question then becomes, how does that gender environment influence our development? A reason to study this in kids who are gender nonconforming or sexual minority is that it's kind of a magnifying glass. It's kids who may be more likely to have a stronger response to the gender environment because they themselves have a more gender nonconforming identity to begin with. And so what we see in the general population may be that there's not a huge response to the gender environment, but when you look at the tails of a distribution, you see a more strong response to environments. So parents can respond to gender variance in a variety of different ways. So this can lead back to that sense of gender schema and how people respond when a child is not what they expected. So more and more parents are accepting, and we've found more and more research about parents becoming accepting. So this is a slide, like Jessica said, I've been working on this work for a long time. So I updated this slide this morning. Lots of new articles have come out in just the last 2 or 3 years on this topic, and a lot more about parent acceptance. There's been work on this since about 2010, and there are more and more papers about acceptance. When parents are accepting, kids do better. So parents who are accepting of gender nonconforming kids have kids who have mental health profiles that look very much like the typical population. Parents can also respond with ambiguity. This is actually the most common response that we've found in our research. So ambiguity doesn't mean they're responding with, oh, well, I don't know how I feel about that. In my research, what I'm finding is ambiguity means that they are both accepting and rejecting. Well, I'll put up with this, but I won't put up with that. Well, I'm happy about this today, and tomorrow I'm mad about it. I can tolerate this, but I just can't tolerate that. So this is the most common response that I find in my research. Dr. Allen's dissertation was all about ambiguity, and found that this was the most common profile of young adults' response and to their parent environment, and that an ambiguous gender response to young adults' gender expression was in fact the most harmful for mental health and well-being, associated with the highest negative mental health profile. There aren't a lot of people looking at ambiguity as a response. People are tending to still think of acceptance and rejection as a single continuum. We're finding really that acceptance and rejection are not distinct from each other, that they occur at the same time. Rejection, for a long time, overt rejection was a primary way of thinking about families. Fewer and fewer studies are finding that there's overt rejection, although there still does exist quite a lot of rejection. In general, rejecting of kids is harmful to children. That shouldn't be a huge surprise to anyone. Being dismissive or verbally abusive, withdrawing support, taking away money, morally objecting on religious grounds, all of those things are harmful to kids and affect their mental health. For the most part, as a species, humans tend not to reject their children. And one of the few places that historically humans have been rejecting of their kids have been around issues of sexuality and gender. So in the 50s and 60s, humans tended to reject their teenage children who were pregnant. And then we went through a phase of rejecting children who were sexual minorities. And we have now come through a phase of rejecting children who are gender nonconforming. We're moving through that phase, and I think we're on the downward side of that, which is a bonus, but it still is happening a fair amount. So this moves us to the concept of if there's a family gender environment and there's this family gender environment that everyone has, how do we measure it and what do we start to think about? My original thinking of this came from extensive interviews. Well, I started with focus groups with trans adults, and when we asked them, how can we serve you better in the community? They said, well, we need health insurance, we need places to stay, we need better shelters. And I thought, well, these are all things that families might have been providing in other circumstances. So then I went back and interviewed about family relationships. And that's where I started to hear stories about the kinds of things that families said or did when kids came out and over the course of time. So we started to develop items from interviews and from interviews with clinicians. And I worked closely with some clinicians in the clinic in the Netherlands, where they had been working with young people for a long period of time and have been doing family therapy with families of trans kids. So we developed a large number of items, and then we first piloted them in community-based surveys with LGBT adults. And then we moved to piloting them in MTurk surveys, where we did a series of MTurk surveys and did our factor analyses. And the thing about presentation mode is now, not see my title. So we did that. We did hierarchy. We did our factor analyses in MTurk surveys. We found our patterns and the various structures. We then moved to testing parents and adolescents together in real time, and we modified for young adolescents. We modified the reading level. We modified a little bit more for gender sensitivity and for the acceptability to parents. For instance, originally in the interviews with community-based adults, young adults, lots of young adults had talked about being hit or physically abused or kicked out of the house. And then when we piloted those items with adolescents who were under 18 and with parents, we were not able to ask questions about physical abuse, in part because parents were not willing to answer questions like that. And our IRB was not willing to let us ask questions like that of people under 18. So we had to change the question about, were you hit or physically abused because of your gender, to have you ever been disciplined because of your gender? So some of those kind of things were changed. Excuse me, I have an animal in my house. So we changed some of those questions for social desirability. Also, for instance, we asked, do your parents feel shame, or have your parents felt shame? Did your parents ever express shame for the younger adolescents, because they may be less able to cognitively to understand what their parents were feeling. So we also incorporated some feedback from a couple of focus groups that we did with parents and with adolescents. So here's some copies of the items. Did your parents ever tell you that others don't approve of your cross-gender expression? Did your parents ever blame you for mistreatment that you experienced? Did they tell you that your behavior is a sin? Did they tell you that your religion or God doesn't approve? This is the morally disapproved subscale. These are some of the parent sample items. Do you ever tease your child about their gender expression? The original item for the young adults was, were you ever ridiculed about your gender expression? So we toned that down a little bit to say tease. Did you ever discipline your child in response to their gender expression? Did you ever ask them to dress according to their sex assigned at birth when attending certain events? And the item for young adults had been, were you ever forced to dress in gender conforming ways? So you can see the shift to a more socially desirable way of wording questions so that parents would be more willing to admit to certain, more willing to acknowledge certain behaviors without having a social desirability bias about them. So these are our initial analyses of the subscales that we found with young adults. there's a total here of, I want to say 37 items. And basically we found that there were two major sub factors, which were family support and family rejection, but that they were not, they weren't independent, and they also weren't highly correlated with each other. And each of them had 3 subscales. So in the area of family support, there was family inclusion, there's explicit care, and there's acceptance and support. In the area of family rejection, we found active barriers to gender care, the disaffirming of gender, and then the arguing of the treating gender nonconformity as if it were morally wrong. When we started to compare these, both in how they factored as well as what the overall levels were for people who were binary versus people who were non-binary, what we found was that the elements of family gender environment were more relevant or less relevant for binary versus non-binary young adults. For instance, putting up active barriers to gender care was somewhat less relevant for people who were non-binary than it was for people who were trans-binary. Part of that had to do with the fact that people who were trans-binary were maybe more likely to be seeking specific gender care, medical care, and saying, putting an active barrier up, like taking you to see a medical professor to try and change your gender expression, or forcing you to dress in gender conforming ways, not, maybe more of a barrier for someone who's trying to actively transition as opposed to someone who is more non-binary. And disaffirming gender, telling you that you're not allowed to socially transition, or treating your cross-gender interests as a phase, is maybe more harmful for someone who is trying to transition actively as opposed to someone who's not trying to transition. In our newest wave of data collection, which I'll get to a little bit later, but we've just this summer been collecting what's our, I would call our validating data collection on this scale. We have compared our non-binary to our binary and to our LGB. And what we find is that parents of binary kids are less likely to disaffirm gender, but parents of non-binary kids, especially non-binary kids who were assigned female at birth, so these are trans-masculine kids who are non-binary, are far more likely to disaffirm their gender. That is, treat their gender like it's a phase, tell them that they're not allowed to transition, and assume that it's an act of defiance. And for those young people, that is especially hard on their mental health and well-being. So that treating of disaffirming of gender for non-binary people was more likely, and it was more highly associated with negative mental health. The putting up of active barriers was more harmful for people who were binary. And when you kind of deconstruct that, back out of it, it makes a lot of sense, because the active barriers for someone who's under 18 would limit their possibility to seek transition services, whereas the disaffirming gender is an undermining of someone's identity. And that person may or may not be seeking transition services anyway at that time. So, so those two subscales about disaffirming gender and having active barriers really play a different role with regard to binary versus non-binary identities. So some of our next efforts to validate, we started with in the community, our pilot sample. So this is with youth. This is the work that Catherine Schaefer did as part of her master's thesis data collection. We piloted our youth version of the scale with parents and youth who were transgender and cisgender, each with one parent. They were 8 to 14 years old. And so about half were genderqueer and non-binary or trans, and then about half were assigned male at birth. this was a predominantly white sample for a lot of reasons. When I ran the analyses on this sample, let me just check the next. First of all, there were floor ceiling effects on several items, which is a continuing theme in our examination of the items with youth, especially with youth who are seeking service. And I'll come back to that in a minute. It modified the reliability and the correlations, meaning that, well, I needed to pull those items out in order to do the factor analyses. But when I did pull those items out, I found very similar scales to what the adults had. There were the same 3 subscales for acceptance and the same 3 subscales for rejection. I similarly found that same difference in disaffirming for kids who are assigned female, and the difference between putting up active barriers and disaffirming gender, as well as on the other side, providing explicit care, like taking kids to the gender clinic, which is obviously far more important for kids who need to go to a gender clinic than for in this case, the comparison sample of cisgender kids who didn't have a need to go to the gender clinic. So we've piloted this same measures or very similar measures, a couple of small changes, but in the clinic in 2 different ways. First, with 59 youth as they've done their intake data collection. So 17% of these kids are genderqueer non-binary, and 70% of them are assigned female at birth. This is mirroring a trend that is happening worldwide, actually, where we're now at about a 5-to-1 ratio of assigned female to assigned male kids coming into gender clinics worldwide. And so this is happening in this clinic too, where these data were collected. So 59 youth aged 12 to 18, about 80% of this sample was white, which also reflects trends in adolescent gender clinics, which tend to be more white than the adult population of trans people. I found, again, the same thing. There's the floor and ceiling effects in certain items, which what that means is that some things were never happening and some things were all the time happening. And when I removed those items, the same thing was happening, that the same 6 scales turn up. When we then did this with prior to that, we tried this with our clinic therapy group, which was just 12 parent-child pairs over 2 time points. And these were kind of interesting. This is work that Sloan Oakley Anderson did. The participants in the therapy group enrolled for a gender clinic, and we didn't collect demographic data on this sample. What was interesting with this group was there were, again, floor and ceiling effects, which there always are in clinics, I think, for a variety of reasons. But we found that the parents versus the adolescents told very different stories. The adolescents did not think there was as much open communication and advocacy as the parents did. This is time 1. The parents are the blue and the adolescents are the orange. And then you see, though, at time 2 that the adolescents kind of come forward and say, oh, well, actually, maybe it's better than I thought it was, or maybe it has improved. It's about a 12-week program. And then you see the parents before and after. The parents get a little bit better in their communication, and the adolescents get actually quite a lot better in their sense of communication and advocacy. What we don't know, there's a sense of diverging realities here. We don't know if there's a change in perception over the time period that youth see, in fact, how much their parents are advocating for them, or how much communication there is, or if the parents do become better communicators, or if simply parents see themselves as communicating better than they actually are communicating. We do see, in terms of the negative things, the parents will say, I never do that. And the kids will say, that's happened once or twice, right? Like, they have teased me before about my gender, and the parents will say, I've absolutely never done that. With the cis kids, what was really interesting, and this is on the community-based data, the parents of the cis kids will say, oh, I have teased my kid about their gender. I've done that. And the cis kids didn't notice it. They said, oh no, my parents have never done those things. So that's, again, data that tells us something about that interaction between the child and the environment they're in, that sort of developmental match, where a kid who's sort of gender conforming may not be as sensitively attuned to the family gender environment as a kid who's less gender conforming. Whereas, so the kid who's gender conforming doesn't notice or report the disaffirmation that their parents seem to think that they have engaged in. Again, from the clinician feedback, we heard more diverging realities. The questionnaires were a lot of fodder for group discussions. The parents improved in their communication with group intervention. Again, the parents said that they didn't ever do things, but that the kids did say that those things happened once or twice. The parents and the younger adolescents see support and rejection in very different ways. So a parent might see something as supportive that a youth doesn't see as supportive. For instance, a limitation on freedom a parent might see as a way of supporting a youth, and an adolescent might see that as limiting their freedoms. Items might not be sensitive enough in a clinical setting, and this is what we're becoming more clear on. And so we've actually been reworking our items to find a way to make them sensitive enough in both clinical and community settings. As you might understand, kids who are brought to a clinic by their parents have parents who are fundamentally supportive of their gender identity. Kids who don't make it into the clinic may be kids who, for a variety of reasons, either have parents who are less supportive of their gender identity or don't have the same resources to get into the clinic. And so ideally, there would be a range of items that have different levels of what you would call item difficulty, so that you can assess for levels of parent support that correct for the level of resources that someone might have to get them into the clinic. Our next steps are to do a stronger link to well-being in this age, although we have found some of that same link to well-being around the dismissal of the disaffirmation for the disaffirmation of gender among assigned females, and that link to higher anxiety or higher depression. We did find those in our initial analyses. We've also considered the impact of a discrepancy score analysis within the family system. So we've begun our pilot testing in clinical parent adolescent group. We've continued validating our parent version. There's some work happening at the University of Kentucky on that also. And we're further modeling support in the context of the identity needs. So which binary versus non-binary. We recently submitted our newest data collection, and we have a new grant that's adapting this child data. So we're finalizing our data collection with our adults. We've just collected, like I explained, our data collection with adults to validate that final adult measure and how it is exactly linked to mental health and for whom. So, the factor structure of it and how for non-binary versus binary people, which factors are associated with better or worse mental health, specifically disaffirmation and limiting care. The child data collection, we have just submitted a proposal for a really exciting new way of using the data, which is a community-based assessment project that assesses for this and for another scale that I've been working on for a long time, and two other scales that another colleague of mine has been working on. So we'll assess for genderqueer identity, which is the other scale, gender development, this family gender environment, and then gender dysphoria. And each of those has just a few items tailored, and we're using differential item functioning as a way to model them to a community-based sample so that youth group workers or school counselors or community-based therapists could do assessment and hopefully refer youth to community resources and interventions that might precede clinic opportunities. So right now, most of the clinics in the country have a 6 months to a 1.5 year wait list. And a lot of young people need interventions sooner than that, but they also need interventions in addition to that. So things like family support groups, where we did see some change on family support from that. And also things like just more identity clarification around things like non-binary versus binary identity development, and mitigation of dysphoria as the psychological aspects of dysphoria and separately from the physical aspects. And so each of those are the types of things where there could be very specific interventions that would complement medical intervention. So those are the kinds of things that we're hoping to assess and support with this new community-based intervention and assessment project. So those are our future projects. So I described those on the last slide. And ideally with a distinct support for non-binary and binary transition needs for each of those types of projects. So I think it looks like we have a question that has come up.
Yeah, so we did have a question pop up. Thank you so much for your talk. Folks, please feel free to engage on the Q&A. I'm gonna start by opening it up for some questions. It looks like, Stacy, you raised your hand. If you wanna, I have got some questions as well, but if you wanna go ahead and, I don't know if you can unmute yourself in this format, given that it's in a webinar format. There, I see you.
Oh, hi, Stacy.
Hello, sorry, I thought I was applauding, so yay.
Oh, yeah.
I had a question early on the ambiguity piece of whether you would get that if the parents were, or different members of the family were accepting versus rejecting, rather than within a person, like between people, would you still then get an ambiguous environment?
So we cover that in the scale. The scale asks for that's covered in the scale in 2 ways. So the last 5 items of the scale specifically ask, do members of your family differ? So like, is one person accepting and someone isn't? Is at least one person accepting? Is at least one person rejecting? Is more than one person? So the last 5 questions specifically ask about, like, do people disagree? Mm-hmm. Then the entire scale is set up so that you can, it's really designed to conceptualize a modern family where the individual has multiple families and family members where they might be going back and forth. So one of the things that we heard when people talked to us about their families was, well, my dad's house is this way and my mom's house is this way, or like, you know, I'm not very close to my dad's new wife, but she's the one who paid for my name change, right? I hate her in every other way, but she paid the $25 for my name change or the $2,000 or whatever. So, so she's supportive of my gender, but she's not supportive of anything else. Well, we said, so the questions are all set up. Is there anyone in your family, or are members of your family supportive? And then it's like a 1 to 5, like never, sometimes, a few times, a lot of times. You know, never, once or twice, a few times, a lot of times. And so it could be that, you know, so never is like, no one ever supported me. It could be like, you know, 1 would be like, nobody supported me except once my great uncle, you know, bought me a pair of Doc Martens or something, right? And then, and that's someone once bought me something good for my gender. The others, you know, 4, it could be like all the time everybody buys me good stuff for my gender transition. So there's a lot of space for people to fill in, and then the numbers are on every scale, and there's a little bit of assumption on my part, but also a sort of long-standing belief system in the background of science that people tend to orient on the numbers anyway. So there's a 0 to 4 and like less is less and more is more. And so, and there's opening to like, is anyone in your family? So there's some of that. So it could be, yes, the ambiguity. So the short answer is yes. Ambiguity could be different people are different ways. And ambiguity, the way we're measuring ambiguity would be, there's higher levels of both acceptance and rejection, or lower levels of both, or middle levels of acceptance and rejection. If there's low levels of acceptance and low levels of rejection, that's just kind of disengagement.
Mm-hmm. Thanks.
Yeah, to follow up on that comment of ambiguity, I think, you know, in watching the evolution of the family environment literature around first sexual orientation and now more gender identity, thinking about how we have historically taken a reductionistic approach in thinking about acceptance or rejection, right? And you have really introduced this idea of ambiguity and provided a lot of nuance. Can you talk a little bit more about, you explained what family ambiguity it is, but can you talk about why it's particularly unique? And in terms of harms, you talked about Sam Allen's dissertation, why ambiguity might be uniquely harmful, right, to young people in the family environment relative to outright rejection versus acceptance.
Yeah, so I will say I should own, you know, in the middle of this work, I took the job at University of Minnesota, and one of my colleagues at Washington State University had on her desk Pauline Boss's book, Ambiguous Loss. And I was like, oh, you know, I'm going to probably meet that person soon. I should read this book. I never read it in grad school. I think we didn't read that chapter in the Green Book. I'm not sure. Anyway, it wasn't part of the Arizona curricula, if I'm ratting anyone out. Anyway, so I read the book on the plane on the way to my interview here. And as I was reading it is when I was doing the final interviews for that first study, the first interview study. And it was all, I felt like I was reading those interviews and thinking, this is exactly the kind of stuff the kids keep talking about, where they just don't know where they stand with their family members. Are they in? Are they out? Their family members, they have these very tenuous connections. Their parents would kick them out, but then they would buy them a cell phone so that they could still call them, or they would say, I never want to see you again, but they would give them $500 a month. So like not quite enough to live on, but like enough to sort of not totally not live. So, or one person, the parents didn't speak to them for 8 years, and this person was on the street and just really only making their own way from 8 years, from age 14 to 22, totally homeless, making their own way. And at age 22, the mother had another child and brought this daughter back into the family because she couldn't bear to not have her know her own sibling. So when I read the book Ambiguous Loss, I thought, wow, this is exactly what the kids keep talking about. And the ambiguity had all the kids who talked about that were so tortured with, am I in or am I out? How do I don't know whether to call or not call. I don't, the kids who were just rejected, and there weren't very many who were 100% rejected, but it was a little easier, like, you know, it's over. I'm not, you know, no love lost. And the kids who were accepted were doing really well. They had parents to support them. It was that constant back and forth, give and take, push and pull, that was really a lot of emotional energy. And so that's kind of what started my thinking about ambiguity, was really moving to a school where people spend a lot of time thinking about ambiguous loss.
Yeah, thanks for expanding on that a little bit. I noticed you have the link for your measures here on the last slide, and I know that they're publicly available. And with our population within our network, we have a lot of clinicians who engage with our resources and watch these webinars. And so I'm wondering if you can talk about the clinical relevance of some of the measures, particularly the family environment measure, and how that could be used clinically to work with families with trans young people.
Right. So I actually think clinically it can be really important in a few different ways. What we're finding in gender clinics, and so it's been used in a few different gender clinics. The genderqueer identity scale and the gender dysphoria scale are being used in a lot of different clinics, and they've been really helpful for because they're so specifically relevant to gender identity. The family gender environment scale, I don't think is being used in as many clinics, but it is being used in a few. In general, parents who bring their kids to a gender clinic are pretty supportive. And so I'm not sure that, I mean, it is helpful because they're not 100% supportive, and it's good to talk through the things that are good to do. And I think it's probably good for parents to see this list of what are positive behaviors. A lot of the things on there are things that were developed specifically out of Caitlin Ryan's original Family Acceptance Project work. And so some of those lists of positive behaviors are it doesn't hurt any parent to see that list. So I think that's useful. For the most part, most of the families in the clinic are pretty supportive before they come in. I will say I've had increasingly more contacts from clinicians lately who are being contacted by families of parents who are ambivalently supportive or not supportive, especially of assigned female children who, and the parents view it as a phase. And so there is a sense that in those circumstances, I think family support would be a good place to intervene, and that family gender environment would be a good place to start, to have a more supportive family environment and to allow the kid's identity to be the kid's own identity. And so that the family is not something that's adding to any strain that the child might be experiencing.
Yeah, absolutely. And I'm thinking too, when you're talking about this group, you keep saying in particular, you know, assigned female who are presenting as non-binary or masculine, thinking about the distinctions of the needs that present in mental and behavioral healthcare settings for non-binary versus those who are potentially more on the binary in terms of how they see their gender expression and gender identity. And I'm wondering if you can talk about the distinctions between some of the needs of that population and potentially in the context of family, how those may be distinct. You kind of touched on it in a couple places in your talk, but just to kind of think about, you know, within trans young people, trans youth, non-binary youth, there's a broad spectrum of experience. And I'm wondering if you can talk a little bit about that as it relates to what clinicians should be considering, mental health care providers should be considering when working with families.
Right, there's a huge heterogeneity within trans and gender nonconforming young people. And I would say that we've come a long way in terms of supporting young people who present at a very young age with gender nonconformity. At 3-4 years old, parents have become just a ton more supportive than they were 10 years ago. And the pathways for development have become more clear, and the research about the well-being of kids who, as 4- and 5-year-olds, are very gender nonconforming and wish to social transition and do social transition and grow to seek puberty suppression, and then, you know, as 14 or 15-year-olds seek gender affirming hormone care. The well-being of that population of kids has become well established in the literature. So that's something that scientifically, I would say in 2010 was not well established, and now here in 2021 is well established. So that's been a massive scientific growth in 11 years. Another major change has been the cultural vernacular and understanding of kids who identify as genderqueer and non-binary. When I first started interviewing, it was like, do we include genderqueer non-binary kids? This was in 2011 in the first study, and we will. And then the language was all brand new, and now in almost any survey that we've done recently, probably 65% are identifying as genderqueer non-binary in a trans study. And a large majority of people who identify as genderqueer non-binary on a survey are saying they don't want any kind of medical intervention. And so what the meaning of that language has changed over time. And why people might use different labels might be changing too. So so that's something to start to document and to measure, to kind of like what a label means and why someone might use it. Parental acceptance of that identity hasn't caught up. And so where parents are and how they respond and what they think identities mean, I think parents still have a way to go. Some parents are working really hard to support and be thoughtful and meet their kids where they are. And some parents are taking advice from a very concerned right wing that's saying, you know, don't listen to this. So I think that's not in the best interest of kids. I think it's more in the best interest of kids to listen to them and to support their thinking and give them space to develop identity.
Yeah, and I think, so this leads me to my next question, probably potentially our final question, is related to, so thinking about clinicians, mental behavioral health care providers who are out in community contexts who don't specialize with this population. I've heard, I know in talking with other clinicians, that they're seeing families you know, enter into the mental health space with children who are presenting as gender nonconforming, non-binary, or trans, and are wondering how to help families, support families, particularly with parents who are struggling with the legitimacy, quote unquote, of this identity and in their process. Like, thinking about it like a clinician who's new to this area, what kind of advice would you give them in helping parents along their journey to be able to be supportive and accepting in a way that's beneficial for the health and mental health of trans young people?
Right. I think the first thing around being supportive of kids is to really listen and let them feel heard, right? And so that's always a first thing. And then second is to check your own concerns, right? What difference does it make if this is a legitimate identity or not in your eyes? It's your child's identity and not yours to determine as a parent. So I think just kind of relaxing about that issue, that does it really matter if your kid wears nail polish or a dress or uses they, them pronouns, or has an identity label that's a word you've never heard of, right? Like, what is really the harm of that? And but then what is the harm if your kid thinks you don't love them or thinks that you don't think they're valid, right? So like, think about the difference between the harm of those two scenarios of using an identity label you don't know versus thinking you don't love them. So which is more harmful there? And then just giving your kids space for any, as you would for any kind of identity exploration. Like, this is your identity and you have space to think this through and be where you're going to be. It might be that 10 years from now, we really as a society are acknowledging and accepting, 5 or 8 genders in a way that we weren't 10 years ago. And I can't predict that or say where we'll be. If this generation of young people is able to change our society in that way, more power to them. It's not our place to stop that. I would say that they don't need to meet the standards that were set forth medically and biologically for the kids who identified at 4 years old and needed puberty suppression. And so that was a different pathway. And there is a set of kids who very clearly transitioned and were quite binary. That's a different set of kids. This is a different identity pathway. That doesn't mean it's any less valid or legitimate.
It's a great starting point. In the meantime, a question did pop up, and I'm wondering if we could just field this in the last 2 minutes, if that's
Sure.
possible.
Mhm.
So they were asking, can you talk a little bit about how your measures of children's gender identity and sexual orientation in your work and family environment could be adapted for use with younger children who may not yet have the full vocabulary or vernacular to describe diverse ways of being in terms of their gender expression, identification, labels, and socialization. So thinking about younger kids and how this work might be adapted.
Right. So we've piloted down to age 8, and then we've done a little bit of work with pictures for even younger kids for the genderqueer identity stuff, like boy, girl, and then putting yourself between. And then like Catherine developed a really good like a boy girl measure, and then like how they overlap each other for her thesis. That was really exciting. We have done some work with like asking all the genderqueer, well, a subset of the genderqueer identity without using the word gender, because to try to not be too privileged, right? That gender is kind of a privileged term. And so, so we do have that subscale, which we've been kind of working with. It's in our proposal. The family gender environment one is a little bit easier because you can ask questions about like, do you get teased about your clothes? Do you get teased about your hair? Did they make you dress a certain way? Did you have to do something at church? Things like that. So those can get a little easier, but for non-readers, you can read to kids, but I don't have a lot of expertise working with like objects and dolls and really young kids. I have worked with some people who have done that kind of thing, but that's not really my area. John, one of my strong collaborators, has worked with kids under age 8 more than me.
Great. Thanks for weighing in about that. I really appreciate it. Hopefully, Flora, that addressed your comment. So we're at time. Thank you so much again for joining us and presenting on your work. We're really grateful to have you, and thanks everyone for joining. Hope to see you at our next webinar.
Thank you.